Let's take a minute and go over the structure of the knee and some of the problems that we might encounter with knees, specifically knee pain. So this is, as I'm sure most of you know, a pretty complex structure. We have a lot of muscle coming in and attaching to the patella and with a bunch of big, strong, heavy-duty tendons. We've got 4 in particular that are coming right down and attaching to the top of the patella and the side, and then that patella tendon coming right down the bottom of the tendon and into the tibia. And then we've got some structural support on either side. We've got that meniscus in the center. But what we want to look at is what's possibly causing some knee pain. So if you're experiencing knee pain, specifically like coming right down here underneath the patella, underneath the kneecap, that may not be an injury, that might not be a problem with your knee, that might be a problem up a little bit higher. So if you find that you're stepping down, stepping off of something, coming down a flight of stairs, or trying to decelerate and lower, and you're experiencing some pain in the knee from about mid-patella down into the upper shin, that may be just some tendonitis. Okay, so what we want to do is we want to get up into like that vastus medialis up in here and start doing some foam rolling, get some soft tissue work done. You're going to know if that's a problem almost right away. So as you get on a foam roller or as you get on a stick or some nice hard rolling surface, you're going to feel like you're rolling over something you left in your pocket. Okay, you're going to feel like a marble or something is in there, and that's that adhesed muscle tissue, or it's some lactic acid that hasn't moved out of the muscle. So we want to apply pressure to that and start moving it out. As that adhesed muscle releases, as that lactic acid is flushed out, we get some fresh healing blood flow in, and that's going to fix a lot of problems. So with that patella tendon, we want to start right up here in that vastus medialis, and we got to get up here into the rectus femoris. Okay, so big muscle on top of the thigh is possibly causing some of those problems. If you find that pain is kind of more off to the side, then we can get on the inside of the leg, we got the Sartorius right here, and this one can be very, very painful to work on. I'm sorry, get used to it. Okay, it's non-injurious pain. So if you're digging in here on that side of the thigh, the inside of the leg, and it hurts, you're going to be okay. All right, so again, that's if we experience some pain on the inside of the knee. If we're on the outside of the knee, right into here, then that vastus lateralis is probably part of our problem. So again, working in through there. If you have knee pain on the outside, okay, then get that IT band, that big structure running right down the outside of the thigh. Start getting on that foam roller, apply some pressure. It's very uncomfortable. This is big muscle, and if it is adhesed, it's gonna hurt. However, if you go to your doctor, your physician with knee pain, like some non-specific knee pain, they're going to tell you, okay, take some ibuprofen and stop doing any activity or exercise for a couple of weeks, which is pretty much a non-starter for most of us. Okay, we're not going to lay off the exercise, the training, and we certainly can't stop life just because the knee hurts. So if we can do some corrective action that eliminates or alleviates that pain, why wouldn't we? Okay. Now, if there is a real problem, if we have a tear in something, if we have blown one of these out, if there's a problem in the meniscus, that's different. Okay, at that point, that is going to potentially need some real rest and recovery, possibly some surgery. But if we can get through the simplest things first and do some troubleshooting and maybe some corrective action before we start looking at injury, then we can save ourselves potentially some real problem there, or having that misdiagnosed. Take care of the simplest things first. Then if that doesn't work, then you can look a little bit deeper, see if maybe there's an old injury in there, see if maybe there's a problem that's going to take a real, some possible surgical intervention to take care of. All right, hopefully we answered some questions, gave you a few tools to start working with. If there's any questions, leave them in the comment section below. We'll see if we can't get those answered for you, and keep your eye open for new videos coming.